Good afternoon and welcome to the Department of Behavioral Health Weekly Update. July is Black and Indigenous People of Color Mental Health Month, and so continue to look out for information via email on different facts and interesting information that you might find useful. I will tell you that we're finishing up the recruitment for our Diversity Services Coordinator, and I'm hoping in the next week or so to be able to announce that position has been filled. All right. COVID by the numbers. We have almost 189 million cases of COVID across the world with over 4 million deaths now. Remember, we crossed that grim threshold last week with 3.5 billion vaccine doses now being delivered. We still have large swaths of the world, though, where very little vaccinations have happened. I believe in Haiti, they're just getting their first vaccines. So in the U.S., just under 34 million cases and just over 608,000 deaths have been recorded. We're now approaching 335 million doses of vaccine. In California, we now have 3.743 million cases of COVID, and we've had 63,533 deaths. Of note, we now are at a 3.5% positive rate in California. That is a 60% increase. Last week we were at 2.1, so we've almost doubled. It's very, very concerning. In Fresno, we've had some additional adjustments. Last week, remember, we went down in cases, and this week we actually went down in deaths, even though we had an additional death. And so they're making some corrections, which should reassure you that when we make mistakes in the government, we are willing to fix them. But we continue to have additional cases, which I'll talk about a little more in a minute. Our hospitalizations have increased significantly. We're now at 58 individuals who are hospitalized, 10 in the ICU. This is the first time in several weeks we've been in the double digits in the ICU, and only 16 ICU beds available, which is a significant decrease from the last few weeks. In terms of our testing, we're now at 3.1% positivity. If you'll recall, last week we were at 2.4%, so that's a 29% increase in positivity rate in the last 7 days. And we are performing fewer tests, and so that's a pretty high positivity rate for us to experience. We are now up to 912,990 doses of vaccine given. We have crossed the 400,000 threshold mark of residents who are fully vaccinated, and another almost 71,000 who are partially vaccinated, which means they've had one dose of a 2-dose regimen. I will mention that we're beginning to see the effectiveness of 1 dose compared to 2 doses, and it looks to be about a third as effective. So we really are encouraging those of you who've gotten 1 dose to complete that 2-dose regimen. You just don't have sufficient protection against the virus with just 1 dose. It's better than nothing, but it's not as good by far as 2 doses. Remember, with the Pfizer and the Moderna, you're at about 95% effectiveness with 2 doses. That goes down a little bit with the Delta variant, but with 1 dose, you're about 33%, and that's not even considering the Delta variant. All right, so about 54.8% of our population 12 and over have had at least 1 dose, and about 85.2% of residents over 65 have had at least 1 dose. But remember, we need that 2-dose regimen to be completed. So our 2-dose is only about 44% or so, which puts us pretty low. So our cases are now on an upward trend. We're at considered moderate risk for community transmission right now. Hospitalizations are on an upward trend in Fresno County. Deaths have slowed, but they continue, and we anticipate as those hospitalizations go up, we are going to see more deaths, and the positivity rate is rising. We have in the Central Valley counties, including Fresno, we have some of the lowest fully vaccinated percentages across the state. So bottom line here, remember, if you're unvaccinated, you are going to eventually get COVID. This virus is infectious enough that over time, if you remain unvaccinated, you will get COVID. Unless you hole yourself up in your house and never go anywhere, you're probably going to get COVID at some point. The longer you wait to get vaccinated, the more chance that a variant has emerged that is more infectious or more deadly. That's just the reality. Those are facts. That's how viruses work. They don't care about politics. They don't care about personal opinions. They don't care about anything but reproducing themselves. And the way that they reproduce themselves is a human host. And so they're just going to keep spreading. We're not going to eradicate the coronavirus anytime likely in our lifetime, unless some magical vaccine emerges, and I know they're working on them. COVID is here with us to stay. So if you remain unvaccinated, you are going to get COVID. So please pay close attention to information that I'm going to be sharing, because that's what you have to consider in terms of how you're going to protect yourself if you are not going to get a vaccination. So new COVID cases in California rose 181% in the last week, with over 14,500 cases. And in LA County, over 99% of the new COVID cases, hospitalizations, and deaths are in unvaccinated individuals. So unvaccinated individuals are getting COVID more frequently, are getting hospitalized at much higher rates than vaccinated, and are dying at significantly higher rates than vaccinated persons. So if you're unvaccinated, you're eventually going to get COVID. If you're unvaccinated, it's more likely that you're going to be hospitalized or die with COVID. Make your good decisions. All right. This is just a national graph to show you that while we were on a very comfortable downward trend, we're now on an upward trend. It's just the very beginning. There's hope for us, but only if we continue to get vaccinated. So at this point, almost 160 million Americans have been vaccinated, which represents about 48% of the population. 22 states are unlikely to reach the 70% vaccination rate until 2022, so at least 6 months from now. There has been a 109% increase in the 14-day average of new cases in the US, and the greatest increases are being seen in the South, the Midwest, and the West. We're in the West. Unvaccinated individuals across the United States are 99.2% of June COVID deaths. Trinity Health, of which St. Agnes Hospital is part of, are now mandating vaccines for employees. You may have heard this. It's certainly controversial. Some people are really unhappy about that who work there and don't want to be vaccinated. But there's been a Supreme Court case that has established that private employers can mandate vaccination. It involved a hospital, I believe, in Texas. And so I don't expect there to be a successful case against healthcare providers who choose to mandate vaccinations. Mercy Health System, which is in Arkansas, Oklahoma, Missouri, and Kansas, has given employees a September deadline to get vaccinated. I believe that Trinity, which includes St. Agnes, it's sometime in August that employees have to get vaccinated. And then I just wanted to remind you that those states with the lowest vaccination rates are experiencing the highest deaths across the United States. So, in some other news, right now there's no clear evidence that booster shots are needed. Pfizer has applied, submitted an application to have a booster shot approved. They believe with some preliminary evidence of a decline in the effectiveness of their vaccine after 6 months, and so they want to be prepared. But at this point, vaccine booster shots are not being recommended. That could change. We'll keep you updated. I do frequently get questions about that. Final approval of vaccines is expected by the end of the year. That final approval will come when at least 6 months or more has passed from the last part of the vaccine trial. and where we've reached a threshold of vaccination where we could detect the rarest of complications. With every medication or vaccine that goes through this approval process, it reaches a point where enough people have received the medication or have received the vaccine or enough time has passed. This is pretty quick that we've reached this threshold of the number of people to be able to detect the rarest of complications. If you watch TV at all and you see those ads or you come across one in a newspaper or magazine, there's always that fine print for every single medication, whether it's for your skin or for diabetes or for heart conditions or whatever, weight loss. There's always complications with every single medication and vaccine. Part of the approval process is to get to the point in the testing where you can detect the rarest. All scientific research into medication and vaccines has a trial of participants. So you need enough participants, I've said this before, but I'm going to repeat it. You need enough participants who both get the vaccine or the medicine and those who don't get the vaccine or medicine to be able to compare the two groups. You can't do it with 10 or 20 people. Usually it's hundreds, if not thousands of people. And then over time, you see if there are either negative effects from the medication that you can call complications, or if there are impacts in a positive way. So if you're getting medication for blood pressure and your blood pressure doesn't improve or doesn't improve any more than the control group, then the medication isn't effective. With a vaccine, what you're trying to see is whether or not people in the control group who did not get the vaccine have acquired the disease the vaccine was protecting against at a different rate, higher usually, hopefully, than people who got the vaccine. So that's one thing you're trying to say is it effective? Is it doing what we want it to do? And then the second thing is it causing problems we didn't intend to cause? So is it effective against COVID? And is it having complications solely due to the vaccine? So a few complications have emerged with different vaccines. With Johnson & Johnson and AstraZeneca, we've seen some issues with blood clotting. Very, very rare, very unusually rare occurrence, but it does, they did detect it, but only after hundreds of millions of doses of the vaccine were given. So lots and lots and lots of people had to be vaccinated for that very small number of people to develop a problem to tell us that this complication is possible and to alert us to that risk. And so we know right now today that the vaccines are effective. We've proven that both by the number of people in the control group who got COVID, way, 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 way more than the people who got the vaccine. So that's been proven. We don't need any more evidence. It is 100% proven the effectiveness of the vaccine. Now, the thing that needs to be measured is all those complications, and that just takes a little more time. There's been enough people vaccinated. We should, those will emerge. And then over time, how long is that vaccine effective? And so that we'll know over time. But that approval can come even before we know that, well, it's effective for 6 months or 12 months or 18 months. Because remember, the main things that the testing approval is looking for is it effective? And does it cause unintended problems? And then over time, will we need a booster shot or not? That can happen after approval. And so I just wanted to give you that little background again to remind you. A lot of people think, oh, there were shortcuts and they didn't have enough people and they haven't given it enough time. And that's quite frankly not true, and misinformation and a lie. And so you can accept that or not, but that's the facts. All right, Johnson & Johnson did announce a risk of Guillain-Barré. And Guillain-Barré is a neurological condition. I used to treat patients in rehab who had gotten Guillain-Barré many, many years ago. It's a very interesting disease process, typically caused by getting a virus. there's not a virus that causes Guillain-Barré, but oftentimes people would get a flu or a cold or some sort of virus, and in them it triggers an autoimmune response that breaks down things in your neurologic system, and you can become paralyzed, even to the point of no longer breathing, and you could die. It's a rare complication. But once they detect that you have Guillain-Barré, there are treatments, and eventually, for the vast majority of people, you will recover. I would see people who'd been hospitalized, oftentimes put on ventilators, and then they would come to the rehab setting, and I would help them build up their strength and learn how to use adaptive equipment like wheelchairs and walkers and such when their strength had been compromised enough that they couldn't walk on their own. And so that's what I did in my role as a physical therapist. But as I mentioned earlier, that's one of those complications that has been detected. It's rare, but it could possibly happen. And then the other thing is that California announced its intention for students to be masked in the fall. I do want to remind you that we've made the decision in our department as a healthcare provider that we will be masked in every part of the department, whether you're vaccinated or not. And I think with the Delta variant becoming more prevalent, that's just what we're going to do. So please don't be surprised or upset if you are unmasked in any setting in the department and you're reminded to put on your mask. Just put your mask back on. That's all we're asking. If we have to remind you over and over, you're going to face disciplinary action. That's just what we have to do. So please wear your mask. Don't put us in the position of having to discipline you. Just wear your mask, whether you're vaccinated or not. All right, we're going to see if we have any questions. Can you explain the reason that county employees' vaccination status is being tracked? Is the County of Fresno planning to make vaccination mandatory once one or more vaccines have received FDA approval? The reason that vaccination status is being tracked is that there are parts of the county, buildings that are not healthcare, where you have to be masked if you're not vaccinated. So when you check in on the app on your phone, it'll ask you what building are you going to. So you have to state your vaccination status, because if you happen to go into the Hall of Records, which I went into this week when I went to a board meeting, I don't have to wear my mask in that setting. I can choose to wear my mask, but as a vaccinated staff member, or a member of the public, I don't have to wear my mask. So that's why you're asked. And members of the public are being asked as well, are you vaccinated? And there's signage up and it says if you're vaccinated, you don't have to wear a mask. If you're not vaccinated, you do have to wear a mask. So that's why we're tracking vaccination status. As far as mandatory vaccinations, I can say in all honesty, I haven't heard that that's something that the county's considering, but I can't guarantee that we wouldn't determine at some point that for the safety of everyone, we would require vaccinations. But that's not anything that's being considered at this point in terms of across the county, broadly across the county. All right, I don't see any more questions. It's a slow day, maybe not a lot of people watching. People are going to watch later. Any questions that you've seen? Okay. So I don't know. I don't know any other way to say it other than I really hope, because I care about you, because I care about your families, that you'll seriously consider getting vaccinated if you are not already vaccinated. But also, let's wear our masks, let's follow the rules in our setting, let's not contribute to a surge again. I don't know about you guys, but I'm tired of these surges. I'm tired of worrying. I'm tired of the restrictions. And guess what? We can control that by our behavior and what we do. And so either get vaccinated or wear your mask and follow the rules, because I don't want to be in a surge again, and I'm guessing you don't want to be in a surge again either. So take care of yourselves, take care of your family members, and we will see you next week.